issue with the flail chest is that every time all of your ribs they expand outward, so every time they contract and expand outwardly to make that negative pressure, because this section right here is broken, this would be your flail chest or flail segment, because that's broken off from the rest of the body. As your muscles are contracting outwardly and pulling these ribs outward, this little section will actually suck into the body because of that negative pressure, because negative pressure sucks in, right? That's why. So, and every time that happens, remember, these ribs, when they break, they don't break nice, smoothly, and even. They're gonna be jagged. So not only is this gonna cause pain to your patient because of the bones rubbing against the tissue back and forth, but at the same time, it's going to cause even more damage because every time the chest expands outwardly, so you can breathe in there to suck in air into your chest, this will also suck in with that. And then the opposite occurs. Every time that you release your air, relax your intercostal muscles to push that air out of your body, this right here will actually push outward as well. This is going to push outward because of the positive air that's pushing out from the body, also causing more damage and pain. So just in case you don't know that, we already have a definition down for flail segment. Well, that motion, that oppositional motion of the chest going outward with inspiration and the flail segment going inward, that opposite movement actually has a word, and it's called paradoxical motion. So if you don't know that, also write this down. Flail chest, this is flail chest, and as a result, this paradoxical motion is the movement of this segment moving backward from the rest of the chest. Okay, so go ahead and write that down real quick. Paradoxical motion is caused by flail chest. Any questions so far? Nope. Okay. Let's keep going. Okay, so some definitions, go ahead and write these down. If you want the actual definition from the textbook, flail chest, fracture of 2 or more ribs, consecutive ribs. That's the one thing I did leave this out. So they have to be consecutive, so back to back, next to each other, and that's what makes it a segment, a section of the ribs, because they're together. Ribs in 2 or more places. Paradoxical motion, movement of flail segment is opposite to movement of the remainder of the chest cavity. Again, I'll give you guys about a minute or two. Go ahead and write these down.